And I'm going to have you squat down. Whoa! Holy smokes! That's great! Oh, he's like, I got to do it again. Are you showing off? All right, we're here today with Maudood, and Maudood is here to get his knees fixed. So tell me a little bit about what's going on with those knees. How long have you been in pain?
Give and take, my right knee maybe 10 years, left knee started about a year or so ago.
Wow.
And it's stopping my mobility and freedom to stand up and walk.
Right.
And especially if I want to bend down on the floor.
Sure.
To pick it up or something or sit, I'm unable to do very discomfort.
So your normal activities, it's really holding you back?
Correct. That's
Okay.
correct.
Okay, so you're looking to find the cause of the problem and fix it
That's correct.
without surgery or injections or medications?
Yeah, I don't believe in surgery or medication either. I just take aspirin, things like that.
Right.
Because I want to, find out that if I can do that without operating or opening up, things like that. Yes.
Absolutely.
Yeah.
So let's talk about that discomfort today. We had discussed earlier from 0 to 10. What is your discomfort today?
Today about 7 or so.
Okay.
Yeah.
Okay. I'm going to have you do a couple different exercises for me. So if you could just stand up for me.
Okay.
Now, where did you feel the discomfort when you did that?
Right here, both knees and here.
And your low back too?
Correct.
Okay.
Yeah.
So in both of those knees, was it on the outside part of the knee?
This one outside, but this one kind of as a whole.
As a
back
whole
and
thing?
front, yeah.
Back and the front.
Back and front.
Okay.
Totally.
All right. I'm going to have you take 2 steps forward. All right. Feet shoulder length apart. Arms right out in front of you. And I'm going to have you keep your heels on the ground, squat down as low as you can go.
That's it.
Okay. Come right back up. Now, where did you feel that discomfort there?
Both knees.
Both knees?
Sharp pain.
Okay. So it was like a stabbing pain that you were getting.
Correct. Both
Okay.
knees.
All right. So now I'm going to have you go up and down the stairs. So make sure you hold on to the railing. All right. And we're going to go back up the stairs. Okay. So which was more difficult, going up or down the stairs?
Pretty much same, but going up is a little bit more
Look-
because I feel that sharp pain here, even outside.
On the
beside
outside, and that's what was going down the calf, right?
Correct.
Yeah,
Correct.
so you starts it in the outside of the knee and then
Yeah, going
works its
up
way
is
down.
A little bit more pressure.
Okay.
Going down, you feel in the knee overall, but going up, you feel that.
Right.
Exactly,
So out of all of those exercises, which one caused you the most discomfort?
yeah. Going up.
Going up the stairs?
Yeah.
All right, so you ready to get started?
Yes.
All right, let's get you feeling better.
And go. 1, 2, 3, 7. Okay. Okay, we can take that off, and I'm going to go right into doing another move. We'll do the psoas right now. Okay, ready? Deep breath. Pull that knee up. 1, 2,
Roll it out.
3,
That's
4,
it.
5, 6, 7. Reach down. Okay, deep breath. Pull. 1,
That's
2, 3, 4, 5, 6, 7. Reach down. Good. Deep breath and press. 1, 2, 3, 4, 5, 6, 7. Release.
All right, Maudood, let's walk down the end of the hall and back. Let's try out those new wheels. What changes have you noticed?
A little bit more ease, and when I'm lifting my knees,
Right.
I don't feel any pressure.
So they're easier to bend?
Correct.
They're easier to bend?
Yeah.
And a little bit smoother? Yeah, yeah. All right, let's go try those stairs. That's going to tell. All right, we're back here with Maudood, and I'm gonna have you stand up for me.
Okay.
How was that?
A little better.
Well, how would I know? Because you said you felt a little bit in low back. How does that feel now?
I don't feel that bad. Yeah.
Good. All right.
It's
So
better.
that's awesome. Take 2 steps forward. Feet shoulder length apart. Arms out in front. And I'm gonna have you squat down. Whoa! Holy smokes! That's great! Oh, he's like, I gotta do it again. Are you showing off? All right, let's try the stairs.
Yeah, very little pain, but I could bend down.
Yes, you could. Oh, and look at that, with just ease.
Let's-
Back up again.
Yeah, no, I don't feel no pain that time. Yeah.
That is
Let
great.
me do it one more time.
Okay.
Yeah. It's definitely better. Yeah.
That's awesome. So what do you have you noticed? What's different?
Well, before I sharp pain, now I don't feel sharp pain. Just a little tingling.
Right.
Bearable.
Okay.
I can live with that. Yeah, able to go up.
Well, you were a 7 when we started. What do you think it is now?
I would say about 3 years.
Okay. Good. Good.
I used to feel, but nothing compared to pain.
So for today, because
Discomfort,
a little discomfort, okay, but the pain is pretty much
Yeah,
gone.
yeah.
Okay. So your homework today is going to be you're going to go for a 20-minute walk.
Okay.
We need to give movement in that joint. The more you move it, the more it's going to get lubricated. And we got to get those muscles nice and strong.
Okay.
Are you happy with today's visit?
Yes.
All right.